Hello everyone, I am Dr. B Ramya, Assistant Professor, PG Department of Biochemistry, Auxilium College. In this video, we are going to discuss about the evaluation of proteins by nitrogen balance method. Through this video, the students will be able to learn the nitrogen balance method, nitrogen intake and excretion, nitrogen balance calculation, also able to learn the limitations and applications of nitrogen balance method. What is nitrogen balance method? Generally, this nitrogen balance method is a technique which is used to assess protein status by comparing nitrogen intake with nitrogen excretion. It helps to determine if the body is gaining, losing or maintaining the protein mass. Nitrogen balance method is a positive nitrogen balance which indicates the protein anabolism, that is the building proteins, and the negative balance indicates the breakdown of proteins. Nitrogen intake and nitrogen excretion. Nitrogen intake indicates, that is, the nitrogen enters the body primarily through the dietary protein, and most common method to measure the nitrogen intake is the Geldal method, which measures the total nitrogen content. And nitrogen excretion is primarily excreted in the urine as urea and phases with small amounts lost through sweat and skin. Nitrogen balance calculation. Generally, the nitrogen balance is calculated as the intake and the output. They are positive nitrogen balance, negative nitrogen balance, zero nitrogen balance. Positive nitrogen balance. In the positive nitrogen balance method, the nitrogen is calculated as nitrogen intake exceed than the output, suggestion of protein synthesis and the growth. Negative nitrogen balance. The nitrogen output exceeds than the intake, suggesting protein breakdown or inadequate intake of proteins. Zero balance. Nitrogen intake equals output, indicating the stable protein mass. Limitations of nitrogen balance method. Difficulty in measuring all nitrogen losses, difficulty in accurately assessing nitrogen intake, limited insight into underlying mechanisms, overestimation of nitrogen intake and underestimation of nitrogen loss. The first one is difficulty in measuring all nitrogen losses. Nitrogen losses through skin, sweat and gas are difficult to measure accurately. Difficulty in accurately assessing nitrogen intake is in breastfed infants. Measuring nitrogen intake is very difficult. Limited insight into underlying mechanism. While negative nitrogen balance indicates a net protein loss, it doesn't pinpoint whether this is due to increased breakdown, decreased synthesis or both. Overestimation of nitrogen intake and underestimation of nitrogen loss. This is due to difficulties in measuring all nitrogen losses routes. Applications of nitrogen balance method. Assessing protein requirements, evaluating protein quality, monitoring protein status in clinical settings. Assessing protein requirements. Nitrogen balance studies can help determine the optimal protein intake for different populations and conditions. Evaluating protein quality. By comparing nitrogen balance on different protein sources, the quality of the protein can be assessed. Monitoring protein status in clinical settings. Nitrogen balance can be used to track protein status in hospitalized patients, especially those with critical illness, and adjust nutritional support accordingly. Thank you.